wishes. I welcome you all to the wonderful journey of learning obstetrics and gynecology. I assure that by the end of our course you will expertise obstetrics and gynecology. I'm very overwhelmed to teach and enlighten you. I have included many series of interesting video clips, animated videos for better understanding and explanation in simple terms. I have divided the entire subject into several parts so that you understand it in a better fashion. In our first session, we will be discussing the basic of obstetrics. Obstetrics refers to branch which deals with pregnancy. Thus, today's session is all about preconceptional care, which holds great importance in practice. In simple terms, preconceptional counseling is an intervention to identify medical history of the women, including family history, genetic disorders, prior bad obstetric history, risk factors, congenital anomalies in family, recurrent pregnancy, loss, sterilization, contraceptive usage, social factors such as women in depression. Since the possibility of exacerbation during pregnancy is high, a skilled counselor should take into account regarding diabetes, hypertension, thyroid, asthma, heart disease, epilepsy, increased maternal age, genetic disorders, uterine anomalies, overweight, underweight, previous child with mental retardation, neural tube defect, since the female should be started on 4 mg instead of 4 micrograms of folic acid to prevent neural tube defects 3 months prior to conception, recurrent pregnancy loss. Example, hypothyroidism should be managed with L-troxin and dose should be increased during pregnancy. Anemia should be corrected with iron supplementation. Long-term drug intake for medical illness. Medical illness and their effect during pregnancy. Pregestational diabetes leads to congenital anomalies in fetus due to free radical formation. Hypertension leads to development of uteroplacental deficiency during pregnancy, thus compromising fetal blood supply. Previously sterilized women who opt for pregnancy has chances of fetus developing in fallopian tube known as ectopic pregnancy. Hypothyroidism leads to recurrent pregnancy loss, miscarriage. Increased maternal age leads to mental retardation and increases the chances of C-section. Rh-negative pregnancy leads to demise of second fetus. Uterine anomalies leads to pregnancy loss. In patients with dermatological and connective tissue disorders, ascertain the drug history and discontinue the drug prior to conception or prescribe alternative medication. Example, isotretinoin, methotrexate are teratogenic drugs. Isotretinoin leads to embryopathy including craniofacial, cardiac. Methotrexate leads to microcephaly, craniosynostosis. Patients of reproductive age who are about to receive cancer treatment, counsel regarding fertility preservation prior to treatment. Epilepsy needs to be treated with monotherapy. Ensure adequate iodine intake in hypothyroid pregnant women. I can understand few terms might be new for you students, but we will be covering everything in great detail. Interesting fact is that following every lecture about a topic, say for example preconceptional counseling, in next session we will discuss real cases in my practice and their course in hospitals. Apart from that, we will be preparing interesting facts and shorts for your knowledge. Thank you.